Now, we're going to talk right now for the next 3 or 4 minutes about a particular drug. First, I'm going to tell you the side effects, and then I want you to try to guess which drug it is. You ready? Short-term side effects include high blood glucose levels, that's high blood sugar, mineralocorticoid effects such as fluid retention, adrenal insufficiency, insomnia, euphoria, mania, depression, anxiety, Cushing syndrome, dementia, depression, osteoporosis, glaucoma, and cataracts, difficulty controlling emotion, difficulty in maintaining a train of thought, weight gain, suppressed immune system, facial swelling, severe facial swelling, depression, mania, psychosis, fatigue or weakness, mental confusion, memory and attention dysfunction, blurred vision, abdominal pain, peptic ulcer, painful hips or shoulders, osteoporosis, stretch marks, osteonecrosis, insomnia, severe joint pain, cataracts or glaucoma, anxiety, black stool, stomach pain or bloating, severe swelling, mouth sores, avascular necrosis, hepatic steatosis, nervousness, acne, skin rash, appetite, hyperactivity, increased thirst, frequent urination, diarrhea, painful leg cramps, sensitive teeth. Suppression from this drug, adrenal suppression, will begin to occur if this drug is taken for longer than 7 days. Adrenal suppression, suppression of your adrenal glands, will occur if this drug is taken for longer than 7 days. Eventually, this may cause the body to temporarily lose the ability to manufacture cortisol, which is an essential part of the fire department of your body, which results then in a dependence on this drug. For this reason, this drug should not be abruptly stopped if taken for more than 7 days. Instead, the dosage should be gradually reduced. The weaning process may be over a few days, a few weeks, or a few months, depending on how much of it you take. Isn't that just great? Boy, I'm going to go right out there and get me a whole bushel and a peck of this stuff. Of course, I'm talking about prednisone. Prednisone is the wonder drug of the MDs. Prednisone is the first, second, and third thing that MDs throw at everything. Prednisone, it is a natural, it is an anti-inflammatory medication. It is an anti-inflammatory medication. Once it is converted into the active form called prednisolone via the liver, MDs use it to damp down inflammation. Now, a colleague of mine, Jarmel, who lives here in Chicago, who calls in from time to time, he's a longevity distributor. He went to a medical conference about a month ago, and the buzz at the medical conference was that everything is caused by inflammation. Right? It's a breakthrough. Medical science has finally discovered that every chronic disease has its roots in inflammation. But they're absolutely clueless as to what causes the inflammation. And so the new, standard for therapy now is going to be different anti-inflammatory medications. Which is like trying to put the fire out without paying any attention to what started the fire. And if you don't pay any attention to what started the fire, it's going to start again. And the stuff that you throw on the fire is going to have negative impacts on the house, right? You never been to a house that's, one room of the house burns down or the garage burns down, heaven forbid, and then the firemen show up, and, it's one wall was in flames and a little bit of the roof, but the entire garage is now demolished because of all of the water that the firemen used to put out the fire. The water put the fire out, but it had deleterious effects on the rest of the house. Well, the prednisone will put the fire out, but it has deleterious effects on the rest of the body. And yet the MDs dole this stuff out like candy. I've always said that if you took antibiotics and prednisone away from MDs, they'd be running around in circles not knowing what to do. And this should scare the bejeebers out of you. Because, again, remember, your medical doctor may be the nicest human being that God ever created, but they are not trained in how to help your body fix itself. They're only trained in how to suppress your symptoms, and they don't give a crap about the side effects that their therapeutics engender. They do not care. It's not their job to make you healthier. It's their job to suppress your symptoms immediately. It's their job to, suppress the blood pressure right now. It's their job to end the pain right now. It's their job to normalize blood sugars right now. They do not care about the long-term effects of their therapeutics, which is why they are the most dangerous people on the planet.